Hello, I'm Dr. Sarah Bullard, the Director of Psychology at Gaylord Hospital and the Gaylord Center for Concussion Care. In this two-part series, we will focus on concussion management. In this part of the series, we focus on concussion identification and symptom management. The signs and symptoms of a concussion are multifactorial. We're always looking for physical signs, cognitive signs, emotional signs, and sleep disturbance.
People will have a concussion and they'll go to the emergency room and they'll have a CAT scan and the CAT scan will be totally normal, so they think, oh, I'm okay. But what's really happening is that functionally they're having difficulty where their brain isn't able to process things in the same speed that it was prior to their concussion, and they can have a myriad of issues from that.
So when we're talking about the physical symptoms of a concussion, we're thinking about headaches, nausea, dizziness, cervical pain, visual disturbances. Your eyes can jump around. You may have double vision, blurred vision, balance difficulties, fatigue.
Some concussions, if they're severe enough, can cause a loss of consciousness on the field. But the biggest complaint that a lot of people can't really quantify is that they just don't feel right. They have a fogginess.
Trouble focusing, trouble paying attention, forgetfulness, slowed processing. You might ask someone a question and they delay in responding. So those are sort of some of the more common cognitive things that we're looking for. In terms of the emotional symptoms, irritability. It's very common, and it's not just due to the fact that you've had a concussion or a blow to the head, it's another actual neurologic symptom. Some experience sadness. Others, though, in general find that they're more moody, what we term labile, may tear up, may laugh inappropriately. In terms of the sleep symptoms that we see, people have difficulty falling asleep, difficulty staying asleep. They just feel drowsy all the time. There's more signs and symptoms, but those are some of the broad things, the much more common symptoms that we would expect.
Concussions can result from a lot of different types of injuries. Obviously, right now we're hearing a lot about sports injuries, and there are a lot of concussions that come from sports injuries. But many people have concussions from motor vehicle accidents. They'll slip and fall, assault. All those things can cause concussions as well.
In terms of other factors that may play a role in susceptibility to sustaining a concussion, there are actually a number. One is a previous history of concussion. So if you've already had one or more concussions in the past, that actually makes you more vulnerable to having a concussion in the future. History of headaches impacts your recovery from a concussion. Age impacts your susceptibility to a concussion. 0 to 4, so infants up until age 4 are much more prone to having a concussion. The next group are children ages 5 to the early 20s are the next most likely to sustain a concussion. And then after that, the next group is the older group, over 75, also at risk for falls, typically in motor vehicle accidents. In terms of what we're looking for and what's really helpful in terms of the information from at the time that the child or adolescent sustained a concussion is what happened, what are the details, what was the force of the blow, because that also helps us predict the recovery to some degree. For example, somebody was checked, how fast approximately do we think the other person was going? It's helpful if we know if there's rotation, if a jaw is struck, because that has different implications, if the head falls back and you strike the back of the head, the front of the head, and also the immediate signs and symptoms and what was their course. What I mean by that is, did somebody start feeling a little foggy, maybe you have a headache, and then 2 hours later the headache got worse, or the next morning the headache got worse? It's important to keep in mind with a concussion, what you see is not what you get. So it's not like when you break a leg. The leg doesn't continue to get worse 2 days later. With a concussion it does, because what's happening is it's at the cellular level and it's a cascade of events. And so you have the time of the event, of the impact, but then you continue to experience problems for the next up to 2 days. Injury is still taking place. So the symptoms develop over time.
We get referrals from lots of different types of physicians who have already done an assessment of their own for the patient. In our clinic, the two entry portals that we use are the neuropsychology exam and physical therapy. As the physical therapist, I would examine the patient. I also do a screening to see if there's something that another type of vision professional should be looking at. After that, we look at our balance, we look at their exertion tolerance, and we also look at any other issues that they might be having, including multitasking.
Years ago, we used to sort of grade concussions. We don't really do that anymore. We really take each concussion individually and we look at each concussion. So you can certainly talk about a bad concussion. We use the words mild traumatic brain injury interchangeably with concussion. And really they signify the same thing in the medical community. But typically when you start talking about a traumatic brain injury, it kind of carries with it the implication that it's a more serious concussion. So there's a lot of talk out there in the public and certainly in research about baseline testing. And one of the more well-known tests is impact testing. And a lot of schools have adopted that and have baseline data on their athletes. In general, the principle of baseline testing is a good one. It makes common sense. If you don't know somebody, it's helpful to have baseline testing so that if anything happens, you can compare. In practice, however, there's some complications that have arisen with that. Students are often tested in groups. They're fatigued. We don't know if they're actually paying attention. And so you start to wonder about the quality of the baseline data. Now that issue aside, research has also shown, and my field is sort of predicated upon this, that you don't need baseline testing. We have data from thousands of children in each age group against which we can compare. I then will take an individual, I will compare them to others that age. So let's say I've taken a 15-year-old, I compare them to other 15-year-olds, and I plot their scores out on the bell curve. So I'm looking to see patterns. Is their attention normal relative to what I would expect for another 15-year-old? Is their processing speed way slower than I would actually think it should be, or that I know it should be based on our data? And so what I would say to a coach or a parent or the student themselves is, if you do not have baseline testing, it in no way impacts our ability to diagnose or treat the concussion in any way.
Especially if you're dealing with an athlete who's very coordinated, especially like a hockey player or a football player, there is a baseline of ability that is required to play those sports, and I can very often compare what would be expected of an athlete of that caliber and what I'm seeing in the clinic.
In terms of recovering from a concussion, certainly I was raised with the get back in the game mentality. I recall having sustained a concussion as a child and got right back up because that's what you did. And I think that we have learned now over the last several years and decades that that is not the right thing to do.
Very often the athlete may not admit to their coach or their parents or their teammates that there's an issue. But if there's any suspicion whatsoever that a concussion may have been sustained, the very first thing to do is remove them from play. At that point in time, having a qualified medical professional examine that patient or student so that we can have them cleared to return to play. Other than that, making sure that if they are injured in any way or they don't feel right, that they identify that right away and try not to play through it, which can be tough. As a student athlete, scouts are coming, your coach is there, all your friends are there, and you don't want to look like, oh, I wimped out. But it's important that they identify that they don't feel well and that they have to be taken out of the game. And almost equally as important is if your friend is the one that was injured and you recognize that they're not right, making sure that your coach knows that. You're not helping them by keeping them in the game when they're injured.
Your brain is vulnerable. You're in a vulnerable state until you're fully healed. And if you get another concussion in the middle of that state, not only will it take less force to produce another concussion, but now we're looking at an even longer recovery. And I think it's really hard with a concussion because you can't see it. And you have to keep in mind that something is going on at the cellular level. And we really want to err on the side of caution to make sure that your son, your daughter, you are healed before we put you back in the game.